So, for those of you who have been listening to the podcast for a while, you'll know from a previous episode that I got diagnosed with ADHD. And actually, right after my diagnosis, I started thinking about and also worrying about what does this mean for me when I get pregnant, when I have to give birth, when I am postpartum as a parent. Like, I really started to think about all of that and researching online. And during my researching, I found Victoria and her social enterprise, Neurodivergent Birth. And I immediately invited her over on the podcast to come and talk about this topic because I feel in the medical system, there is very little information about truly what it means for a neurodivergent person to get pregnant, experience labor and birth, experience postpartum, and life as a neurodivergent parent. And I was so grateful when I found Victoria. And this episode really warmed my heart and also took away some of my own worries. And I'm just so grateful for her work. And I hope that neurodivergent people who are listening may feel some reassurance and some peace after listening to this podcast with Victoria. And Victoria is a birth and postnatal doula who supports families through pregnancy, birth, and beyond. And she believes birthing people have the right to a positive birth and postnatal experience. And this can be achieved with the help of consistent and compassionate support. She offers support both in person in Aberdeen, Scotland, and online anywhere in the world. She's also a trained traumatic birth recovery 3-step rewind practitioner and perinatal emotional health and well-being practitioner. She's also a mom of 2 girls, one of whom is autistic, and she's passionate about improving support for neurodivergent people perinatally. I hope you enjoy this podcast. Let us know what you think. You're listening to the podcast of Iris Josephina. If you're passionate about exploring the menstrual cycle, cyclical living, body wisdom, personal growth, spirituality, and running a business in alignment with your natural cycles, you're in the right place. I'm Iris. I'm an entrepreneur, functional hormone specialist, trainer, and coach, and I am on a mission to share insights, fun facts, and inspiration I discover along the way as I run my business and walk my own path on Earth. Here, you'll hear my personal stories, guest interviews, and vulnerable shares from clients and students. Most people know me from Instagram, where you can find me under @CycleSeeds, or they have been a coaching client or student in one of my courses. I'm so grateful you're here. Let's dive into today's episode. Hi, Victoria.
Hi.
Welcome to the show.
Thank you so much for having me.
I'm so excited that you're here, and this topic is really, really close to my heart.
Yes.
I have been diagnosed with ADHD myself last year, and I'm on my preconception journey. So this really fits into where I'm at. And I've been having a lot of conversations with people about this specific topic. So I'm very sure that our conversation will help a lot of people or create clarity.
Yes, I hope so too.
And so before we fully dive in, I'm interested to know a little bit more about you. Like, what's your background and how did you get interested in birth work?
Yeah, sure. No problem. So I actually live in the northeast of Scotland, and I'm 40 years old. And in my sort of first career, I suppose, I worked as a marine biologist. So it's been quite a change in career, definitely moving into birth work. Yeah. But really, the catalyst for that move was having my own children. So I have 2 daughters, aged 7 and 5. And I had quite a difficult, challenging time having them, and postnatally as well. And it really sort of led me to be very interested in maternal mental health and supporting people who are navigating the whole perinatal journey. So initially I trained as a breastfeeding supporter. That was something I was really passionate about helping people to do. And then as a family, we moved to France when my second daughter was 6 months old. So that was a kind of opportunity really for me to have a think about what I wanted to do long term. as a career. We were in France with my husband's job, and I decided that I was going to really indulge my passion for supporting the perinatal time. So I trained as a doula. I initially worked supporting members of the expat community in Paris where we were living, so the English speaking expat community. My French isn't quite good enough to support the French community. Um, and it was a time where people were, navigating some challenges as they were embarking on having families. A lot of the people were, living in Paris away from their families, away from their native country, perhaps having barriers with the language and in accessing antenatal education. So I did a lot of postnatal work, actually, working with families in their homes as they adjusted to life with a newborn baby. And I really fell in love with the role of the doula. So we returned to Scotland about, coming up for 2 years ago now. And I've continued the birth work since. And I've now kind of gone on this other journey as well, which we're going to talk about today, which is supporting neurodivergent perinatal experiences.
Yeah, super interesting. How did you eventually decide to kind of like niche your work in neurodivergent pregnancy, birth, and postpartum?
So again, it's from personal experience being the kind of the driving force. My now 7-year-old daughter was diagnosed as autistic and with ADHD about a year ago now. And really, as a lot of parents will relate to of neurodivergent children, I just completely immersed myself in the reading and research around the topics of autism and ADHD. And I really began to look at my own experiences in childhood with a different lens, because I really feel that, my daughter is very much navigating a lot of the things that I had to navigate as a child, but perhaps without the same understanding and support behind it. But at that time, I was really getting into the stride of things with my birth work. And I thought, gosh, we are not talking about this topic enough. We're not talking about what it is like to navigate the perinatal journey as a neurodivergent person. And there are differences. There are areas of challenge, but there are areas of positivity and joy as well. But because of the way that, our maternity care is set up in most of the world, we don't treat people as individuals with individual support needs. We often are following, a very prescribed policy and procedure, and everybody should be treated as an individual, I believe, in their care. But particularly for neurodivergent people, there may be some quite specific support needs around topics, including sensory processing, communication as well. We have different communication styles, executive functioning, so our ability to kind of analyze a task needs doing right through to completing that task in a timely manner. We can have some issues with focus, with prioritizing, with organization and time management. And then many people who are neurodivergent are navigating life on a foundation of anxiety. It is difficult to function in a world that is very much set up to meet neurotypical needs. So a lot of us are, approaching the perinatal time, approaching pregnancy, birth, and the postnatal time with a foundation of anxiety anyway, which can really be exacerbated during that time, particularly because there are so many elements of that time that are quite difficult to control. So I started a podcast on this topic, and I've had some really wonderful conversations with neurodivergent people about their perinatal experiences. And we talk about how to improve understanding, awareness, and support for those experiences.
Oh, this is so needed.
Yeah.
And so beautiful that you felt the call to focus on this and provide a platform for people to listen and talk about this.
Yeah, I agree.
Yeah, you already mentioned that our perinatal care is not very individualized. It's
Yes.
oftentimes very protocolized.
Mm-hmm.
In your view, how does neurodivergent prenatal care differ from neurotypical care? Or how would you like to see maybe even a new paradigm of neurodivergent prenatal care?
I would love to see more awareness from the health professionals, from the birthing professionals about the ways that neurodivergence may impact the perinatal journey. And then we can ask a person what their support needs might be around some of these key themes. So I think sensory processing is a really great example of how there might be some differences and there might be some areas of support. If we think about the senses and how our senses are just bombarded with information every second of the day. When we're navigating pregnancy and birth, it's a hugely sensory experience. There's a lot of information coming our way. The way we feel within our bodies also changes. The way we experience our senses changes. It's a real time of heightened sensory sensitivity. And for people who have sensory processing issues, some people may be what we call hypersensitive to some stimuli, so very reactive to the stimuli. Others are hyposensitive, so underreactive to those stimuli. You know, when we think about the perinatal time, we might suddenly have a requirement to attend medical appointments in noisy environments with bright lighting, with lots of other people there. And we might be sharing ward space with all those other people, but also their babies and potentially their visitors as well. And then the sensations of birth in itself can be experienced on a very different level and can be intense. And the elements of pain that people might experience can be experienced differently. Many neurodivergent people have a different experience of pain and how it's registered. And then when we go into the postnatal time, suddenly having all the sensory output that's associated with looking after a newborn baby can be overwhelming. So, I mean, that's just one element of neurodivergence, the sensory side of things, that can be experienced really quite intensely and differently for people who are neurodivergent compared with neurotypical peers. So I would love prenatal care. I'd love maternity workers to have an awareness of that and to be able to support somebody in modifying their environment and modifying the way that a service is delivered to take into account those sensitivities and those sensory needs.
That's beautiful. And I think many people have never thought of this.
Yeah.
Like the way that neurodivergent people process literally everything in their environment and
Yes.
their internal environment is very different than what is neurotypically known to people.
Absolutely.
And with that, I also feel that neurodivergent people will always try to adapt. Like something that is very common is trying to adapt in the best way possible to the environment, but also masking,
Yeah.
which I feel is a very big burden, especially when you're pregnant and are running on hormones you're usually not running on.
Yeah.
Have you seen that people who are pregnant feel that they need to, adapt to like the system?
100%. I think females are particularly socially motivated and very, very good at masking as a result of that. And when it comes to pregnancy and the birth and even to being a parent, there is a kind of a sort of a social construct of what you should be doing, right? We have a lot of pressures around, well, pregnancy should look like this and your birth should look like this, and if it's not like that, you've got it wrong. And parenting, the list of shoulds are unending, basically. So if you're somebody who masks or has perhaps even no idea that you're masking because that's the way that your life has been since you had to navigate things as a child, it's hugely draining, it's hugely exhausting, and it can lead to, some real difficulties in terms of mental health. And we talk about meltdowns and shutdowns quite a lot. And that's a place that people can reach when they've just completely overwhelmed with perhaps the sensory environment or the pressures of communicating that are suddenly put on us when we have to go to all these appointments where we're suddenly meeting all these new people. We're encouraged to socialize with other pregnant people and new parents. We can just reach a point of complete overwhelm, and that can become really difficult to manage. And it can also become quite problematic in a healthcare setting. So if we are somebody who shuts down when we're overwhelmed, we kind of go inward, and maybe we stop talking, we go quiet, we're in real kind of going into basic functions mode. That can be misinterpreted in a healthcare setting as somebody who is consenting to something that they might not actually wish to be consenting to. So I think, again, awareness, both within the professionals, the birth professional world, that these things can happen is really important. And I also think that antenatal education for neurodivergent people, which highlights some of the things that might come up and might be challenging, and how to seek support in those areas, is also really important. And that's one of the things that we're currently working on at the social enterprise that I run, which is Neurodivergent Birth. We're developing antenatal education specifically for neurodivergent birthers and their families.
Oh, that's really beautiful and really needed.
Yeah.
Thank you for all the work and effort that you put in to create that.
Thank you so much. Thank you.
Yeah.
I think it's really important. And ultimately, when I look at my daughter, I don't know if she'll have children one day, but I really hope that if she does decide and is able to have children, that she is navigating this time with much better understanding, awareness, and improved support. So that's really kind of the driver for this, is for neurodivergent people like her, who will hopefully go on to have their own families. And I also really think it's important as a foundation for family life, neurodivergent families getting off to the best start possible on a positive experience of pregnancy and birth in the postnatal time, gives them that foundation. Too many families, I think, particularly neurodivergent families, start their lives together on a foundation that's quite traumatic. And that's something that I really think can be changed with this better understanding and awareness of support needs.
Yeah, I totally agree.
Yeah.
And I can imagine, if people are listening right now and they are maybe wanting to get pregnant,
Yes.
what would you recommend to neurodivergent people getting pregnant?
I think it's the whole perinatal period, right from trying to conceive, can be stressful. Well, for everybody, but particularly if you're a neurodivergent person who really needs normally to have a sense of what's happening, a sense of control, perhaps a routine. The things that make us feel safe tend to be the things that are predictable. And unfortunately, we don't have a predictable time when it comes to conceiving and to then going on to having a baby. There is a lot of uncertainty. So I think it's about recognizing that, showing yourself some self-compassion about how you might be finding that challenging, that uncertainty, and perhaps getting some support to navigate that. I also really recommend becoming as informed as possible. I recommend this for everybody I work with as a doula, because there are a lot of choices and decisions to make along your perinatal journey. And often we're surprised at the things that are not default within our healthcare setting. So things that might be really important to you may not be default for your particular healthcare provider. But we don't know what we don't know. So unless we do our research and really become informed about the physiology of pregnancy and birth, but also the different medicalized interventions that might be offered to us down the line, then it's very difficult for us to give informed consent to those things. And really, I say this a lot, but it's so true that consent is not really true consent unless it's informed. So absolutely doing as much research as possible as you can about all those different times that are hopefully to come. It can be very useful, but getting support during what is an uncertain time, whether that's, a therapeutic type of support, or if it's, activating your parasympathetic nervous system, that's our rest and digest nervous system. That's where we feel safe and we're not operating from a place of fight and flight. We're feeling safe and calm and connected and loved. And we can activate that in many ways, right from yoga through to listening to relaxation MP3s to cold water swimming. There's lots of different ways to activate your parasympathetic nervous system. And I think that's really important part of the journey.
Yeah, thank you for sharing that. And something that comes up for me when you share all of this is that sometimes when we are doing all these things that are so good for us and so right for us, they may be perceived by our community as weird or strange. Like in my personal example, I am on my preconception journey.
Yeah.
And I already have lists for things that I need during birth, during labor, postpartum. Like I have prepared everything so it's out of my brain
Yes.
and I don't have to think about it. And basically, I can get pregnant and I know everything is there on a list in a drawer and it doesn't have to sit in my brain because I've thought about it and I can just be with my pregnancy.
Yes.
But what I notice is that a lot of people, especially neurotypicals, they're like, oh my God, like you're obsessing so much over it and you cannot prepare ever. And you don't know how things are going to go. But it's so helpful. And I do want to give this piece of recommendation to people who are neurodivergent. Like it can help so much to think everything through before you even get started.
Yeah.
So that it's out of your brain, because our brains can get so overwhelmed and so full.
Yeah.
And I can tell for myself, I haven't even started to try to get pregnant, but I feel so confident about having all of these preparations done and having them in a drawer.
Yes.
Just the peace it gives me is like beyond. So
absolutely.
Yeah.
That's so good. I'm so glad you've shared that, because I think it should be normalized. And it's a shame, isn't it, that the judgment that comes with that, like saying comments about you being obsessed, etc. I think, particularly for the neurodivergent brain, anything we can do to help sort of get some of these things down on paper and away from the kind of chaos that can sometimes be going on in our minds. And that brings real reassurance, and that's really important. And it's only through doing that preparation in advance that you will bring yourself some peace of mind. And also you will thank yourself 1,000 times over when you actually need that information, because you won't be scrabbling around for it at a time that you might be feeling quite vulnerable. Depending on what's happening, you'll know exactly where to go to get it. So I always recommend that people plan for pregnancy, plan for birth, and don't forget to plan beyond. Plan for what your life with a newborn is going to look like. Of course, you won't know for certain exactly what it's going to look like, but there are some key themes that you can talk about with your family, with your partner, and start to imagine that life, because it will help you when you get to that point, for sure.
Yeah. Exactly. The way that I now usually explain it to people is like, what if I'm nauseous like 24/7 for 9 months? I'm not going to want to break my head about what I want for labor and birth and postpartum. Like, then you have to just be with your body and what it's doing. Because I also feel that people who are neurodivergent experience a wider variety of internal body sensations during pregnancy.
Definitely, yes.
Because of their
interoception.
Yeah. Because of their neurotransmitters and just the way that our brains are wired. And I think people don't think about this enough.
That's absolutely true. So we talk about interoception being the sense that's really around kind of what's going on inside of our bodies. So that can include everything from thirst to, hunger and need to use the toilet, how tired you're feeling, etc. And those senses, or that sense of what's going on inside your body, can really change during pregnancy and birth, and postnatally as well. So for neurodivergent people, often those changes are really felt, they're magnified compared to the neurotypical population. And definitely, the example that you gave with the nausea is very valid. There are lots of anecdotal examples of people with neurodivergence really suffering with the nausea and suffering with hyperemesis, which is the, very severe form of sickness. I myself had hyperemesis with both my pregnancies.
Oh, wow.
And I really couldn't have done really anything other than, rest during that time. So I think, you don't know quite how you might experience it, and preparing in advance is absolutely the best thing to do for you and your family. Absolutely.
Yeah. And would you say to already start doing this in the preconception phase? What's your take on neurodivergent preconception?
I think definitely, if it feels comfortable to do so. I know for some people it can feel challenging to kind of imagine beyond where you are now if you're in the preconception phase and you're having some challenges. But If it feels comfortable for you as an individual, then yes, I would absolutely recommend doing that. I would also recommend starting to talk to healthcare providers and see if things like being able to visit. In the UK, we have labour wards and we have maternity-led units, midwife-led units, sorry, I should say, which are like birth centres. So we have a right to request to visit some of those spaces in advance. So if you're, for example, if you're an autistic person who has sensory processing sensitivities, you might want to go and visit a space in advance to get an idea of, okay, what's challenging in this environment and what adjustments could I ask for my own birth in this environment that would make it more manageable and less likely for me to feel that sensory overwhelm. So all of these things can be done at a time when you feel comfortable individually to do them. There are no rules with this, but anything that you do now can really help you down the line, right from visiting spaces to, testing out nursing bras and, working out if they're an issue for you from a sensory point of view, or there are alternatives that are more comfortable. This will all help you in the long run to really have a smoother transition into pregnancy and parenthood.
Yeah, thank you for sharing that. Yeah, I feel there is so much we can already do for ourselves to start this journey, like you said, informed and from like a little bit of a calmer space, because there is so much that comes with preconception and pregnancy and birth and postpartum and parenthood. Like it's a lot.
It is a lot.
Yeah.
Absolutely. Yes.
And to close off, do you have any wisdom for neurodivergent people who are listening, who want to have a baby, but they're maybe overwhelmed by, am I going to be able to actually do this? Or how is it going to be for me? Do you have any wisdom for people?
I think just some reassurance that you are enough and you matter as an individual, and your neurodivergent experience matters, and your neurodivergence can bring with it so many elements that should be celebrated. I really want to celebrate the diversity in perinatal experiences, and I think that's part of this conversation. We can talk about some of the challenges, but let's also talk about the positivity. So the sensory joy of having a baby and having, making a start to your life as a family together. And so many neurodivergent people are just such wonderful parents because, I generally find that there is this real desire to parent and to do it well, and there's a lot of there can be a lot of hyper focus right on the topics. So somebody, for example, who is keen on breastfeeding will probably have almost got a PhD thesis in the topic of breastfeeding by the time that they actually get to do it. So the research, the love and the care and attention that neurodivergent people put into things that they care about and they really focus on is amazing. And that can be frustrating sometimes for them. For example, if you then go to see a health professional with a breastfeeding question and you realize that you actually know much more yourself than the health professional on the topic. But I think that's a wonderful thing that can be celebrated. So
yeah, I feel so seen when you say all of this.
Yes. It's from personal experience as well. But I think many elements of pregnancy, birth, and parenthood you will know so much about. You will have done all the research, and you will be absolutely giving it your everything to do it to the best of your ability and for your family. And I think that's to be celebrated. But yeah, you matter as an individual. There will be times when you feel that people are making assumptions about you or kind of trying to cast you in the neurotypical mold. So it's about, knowing your differences, communicating your differences if you can, and if that's uncomfortable, perhaps having a support person, an advocate to help you communicate those. I absolutely love the role of the doula in the whole perinatal experience because I think this is about developing trust as well, trust in the people that are supporting you. Having a doula means that you have the time to really develop that rapport and that trust and to have a relationship with each other and get to know each other, and they can get to know your support needs. But yeah, to stand tall and say, this is who I am, these are my individual needs, and this is what I need so that I can, navigate this time and have the smoothest transition possible, to stand in that and to celebrate asking for what you need.
Thank you for that.
You're welcome.
This is really helpful. And I think as neurodivergent people, we sometimes also just need to hear that we are worthy, that we are good as we are, that we're not like broken.
Absolutely. Yeah.
It's just a different way of approaching life, seeing life, and having just a different type of rich experience of what.
Absolutely. Yeah. I couldn't agree more.
What life is.
Yeah.
So I'm very curious about all of your beautiful work coming out.
Thank you.
And I'm sure other people are too. So maybe you could share where people can find you right now and where they can potentially find all of the beautiful things coming up.
Thank you. I'd love to share. So on Instagram, we're at Neurodivergent Birth. And in the UK, we're registered as a social enterprise. So we're a not-for-profit company. At the moment, we're running workshops for birth workers. So we have midwives, doulas, hypnobirthing instructors attend our workshops all about supporting neurodivergent birth. And they're run online. And all the details of those workshops can be found at ndbirth.com. But I'm super excited because this year we're also working on offerings for pregnant neurodivergent people and their families. So we're working on this antenatal education. We have a course launching next week that's a 2-hour workshop, and then the antenatal course will be a much more involved workshop on a platform that you can download and take your own time to go through, because that's one of the things that I'm really keen on, is that antenatal education is more accessible to people who might have delayed processing or might need to listen to something in an audio format or read it in a transcript and then watch the video or process it in different ways. So that's what we're working on this year. And we also have the Neurodivergent Birth podcast. So we're about to go into season 3. Everybody on that podcast is a neurodivergent person who has real lived experience of navigating this time. So if you are somebody who is neurodivergent and listening and you feel that you'd like to listen to other people's experiences, then that would be a great place to start.
Thank you so much. I'm sure that people are very interested to go there and learn more. And I want to really thank you for taking the time to come on here and come shed some light on this very super important topic.
It's my pleasure. Thank you so much for having me.
You're so welcome. Okay, this wraps up today's episode. Thank you so much for listening. Want to know more about me? The best way to reach me is via @CycleSeeds on Instagram. And if you heard something today and you think, oh my God, wow, I learned something new, feel free to share the podcast on your social media and tag me, or leave a review or rating. In this way, you help me reach more people like you. Thank you so much.